Hi there, my name is Dr. KS 2015, and today it looks like we're going to be examining your teeth just to make sure that everything looks okay. So without further ado, we're going to go ahead and get started, okay? Alright, so first, I've got my mask on just to make sure that I am protected while I'm examining your mouth, okay? Next, I'm going to go ahead and put on my latex exam gloves. Okay, first I'm just going to do a preliminary check of your mouth just to make sure that everything looks pretty healthy. So I'm just going to have you turn a bit to the side here so I can take a better look. And I'm going to go ahead and stick my fingers in your mouth, okay? So just gently checking. Let me know if anything hurts. I'm going to check a little bit below your chin here for your lymph nodes and other glands here. Just let me know if anything hurts or is uncomfortable. Sometimes there's a bit of irritation in this area. Any kind of swollen tissue right in this area here, right below your jawline. Okay. Let me turn this way back a little bit, thank you. I'm just gonna feel around the edges of your cheeks, just on the outside, kind of towards the bottom of your jaw, just to make sure that everything feels normal. Okay, turn this way for me. Good job so far. Okay, thank you. So now I'm going to take out some of my dental instruments and we're going to have a look inside your mouth, okay? There's a lot of dental tools, but we got to go ahead and get this done, so. So these tools get cleaned after every use before we use them on another patient. So don't worry about them being dirty or anything. They're completely clean. They go into our autoclave after every cleaning. See, they even sound pretty nice. Kind of a metallic noise, but kind of soft at the same time. Okay, so first I'm going to just use this mirror here, as you can see, to just kind of examine parts of your mouth that I can't immediately see with my eyes. So I'm going to turn on my headlamp just to get a better view. We don't want it to be too bright because that's just blinding and annoying, but I want it to be bright enough that I can look into your mouth. Okay, so open nice and wide for me. Good. put my fingers in here, feel the insides of your cheek. Okay. Feel the other one. All right, open nice and big for me. Okay. So far, it looks so good. Just keep the tongue still for me. Okay. Just kind of looking at the back of your teeth right now. I'm gonna have you turn a bit this way for me. Thank you. Perfect. Okay, open nice and wide. Okay. Just looking at the incisors. Okay, everything looks pretty good, I would say. About how many times a day do you floss? Okay. One time, sometimes that's lucky. Okay, good. Well, we prefer that you floss every day, but from the looks of it, it looks like you floss at least once or twice a week, which is really good, quite good actually, so good job. But we're going to do a pretty thorough cleaning here, just to make sure that by the time that you leave the office that everything looks good. So with that note, I'm going to take my scaler tool here. This is used to remove bits of plaque from your teeth. And I'm just going to kind of feel around the front of your teeth here. Yep, see, I'll kind of touch kind of where I'm going. I'll have to check around here, this area. And then we'll get over to this side and then we'll do the upper side, okay? All right, so go ahead and turn towards me and open nice and wide. We're just gonna check just to make sure that everything looks good. Which honestly it does. It looks pretty good. Your gum tissue here, as I can see while I'm poking, is nice and soft and pink, which is exactly what we want. We don't want gum tissue that's super hard and abrasive, or super bleedy either, or bloody, because that will indicate problems later down the road. All right, turn this way a little bit. There you go. I'm just gonna have a look in here. It looks pretty good so far. Of course, let me know if there's any pain or discomfort. We don't want this to be a overly uncomfortable experience for you. We want it to be beneficial, but not painful. You know what I mean? Okay. So I'm gonna have you turn even further that way for me. And let me just readjust a little bit. Okay. I'm going to I'm gonna move you over just a little bit like this, just so you're a little closer to me. Okay, I'm gonna have you turn back here just a little, and I'm gonna check your teeth here on this side. Okay, go ahead and close, bite together. Looks pretty good. Okay, yeah. Just open for me again. Okay. Yeah, quite good actually. Okay. So now I'm gonna focus on the top teeth for a bit. But for this job, I'm gonna use my mirror here because that'll just help me kind of see everything a bit more as I'm working. So I'm going to take this. We're just kind of gonna feel around the edges here. Okay. I'm gonna readjust my light just a little bit. Okay. Now it looks like you do have a little bit of plaque buildup in here. So I'm just going to try to get all that out as much as I can. All right, yeah, relax your jaw just a little bit. Okay. Okay. I'm also going to check. Yep, there you go. Okay, I'm also going to check your molars in the back for any kind of decay. So far, everything looks good. You've got really healthy teeth, actually. You know, some people come in here, they're like expecting to get cavities filled and stuff, which of course is an option, but we try not to do that unless absolutely necessary. All right, I'm going to focus a little bit on this area here. I see a little bit of plaque buildup that I want to address, especially right there in those pockets. Right there. You can kind of feel it as I'm taking it off right there. Okay. And yes, yeah, the back teeth are typically the hardest to clean because they're just so far back there, you know? Okay, overall everything looks pretty good. I'm actually gonna feel the soft tissue around your mouth, but first I'm actually going to get changed real quick just to make sure that I have all the proper gear on. So real quick, I'm going to put on a gown here just for extra safety. Okay. Normally I have a scrub tech here to help me with this, but we're a little short-staffed today, so just bear with me while I get changed real quick. Okay. And now I'm going to take my surgical gloves and I'm going to put them on real quick. Okay, just stay nice and still for me. We're almost on to the next part of the procedure here. It's all standard practice. Okay, just gonna get back to looking in your mouth. Okay, what I'm gonna do here actually for this next part is I'm gonna use this spring mouth gag on you just to, you know, just to help keep your mouth open while I examine it. So this shouldn't hurt much at all. Just, you know, just relax a little bit. Just kind of keep that mouth kind of loose, and I'm going to help guide it in. There'll be a couple clicks, and then everything should just kind of fall into place. Okay, how's that? It's okay? One more? Okay, let's try it. Okay, I think that's pretty good. I'm just gonna check to make sure that it's not pinching anything. Okay, perfect. What I'm gonna do next is I'm going to take one of my other scaling tools here, I'm just going to use this to kind of get in on the front here, just checking the work that I've already done. I don't want to miss anything. Okay, let's see. Okay. Gum tissue looks pretty good. What I'm going to do now is I'm going to get out my feeler gauge, which is a tool that will allow me to essentially measure the depth of the pockets of your teeth. While this isn't the most comfortable procedure, but I think it needs to be done just to ensure that your gums are nice and healthy. So I'm going to have you stay really still for me. I'm just going to slowly insert this. I know it hurts. That's why I have this in here, just to kind of keep you still. Just stay still for me. Okay. Pockets are looking pretty good. There's a little bit of swelling and some bleeding right here. So what I'm actually gonna do is I'm gonna spray this with some anesthesia right here. Okay. Now to help a little bit. Okay. Just gonna keep feeling around. Just gonna make sure that we get everything here. And you have had your wisdom teeth removed, right? That's what I thought. Okay. There's a little bit there on your tongue. I'm just gonna get that off for you. Yeah, don't try not to swallow it. Okay. It's a little wet, but that's okay. Okay, I'm gonna remove this now. And I'm gonna go ahead and get out the dental floss. And what most people actually don't know is that you shouldn't use dental floss with your pointer fingers. You're supposed to manipulate it with your middle fingers here. You take it and you twist it. So I'm gonna go ahead and I'm just going to floss those teeth just a little bit. Oops, it's slipping. There we go. Just to make sure that we get all the spots. Honestly, having someone else floss your teeth would be so much easier every day, but not everyone has that luxury, which is partially why you guys just come to us. All right, I'm gonna have you turn this way. We're gonna floss all the way to the back. Yep, stay nice and loose for me. There you go. Almost there. Okay, then I'm gonna have you turn this way. I'm going to readjust. I'm going to floss here. Perfect, okay. Change my gloves again one more time. Just to kind of make sure that I'm staying nice and still the whole time for you. And these gloves are a little tight on me, but they'll fit. Sorry, it's taking me a second. I just want to make sure that the gloves and the gown fit well together. Okay. So obviously we're going to have you back again for additional treatments, but this is a really good first step to just kind of gauge your oral health and everything. So, okay. So open wide again for me. Okay, yeah, your teeth are looking really good so far. Okay. One more thing that we're gonna do, I'm just gonna keep that open, is going to check your tongue. So this is actually like a tongue scraper. So I'm just gonna have you open wide, I'll help you. And I'm just gonna check the surface of your tongue. And what this will actually do is we'll scrape your tongue like this, and then we'll send off the results for the lab to test. They can test for certain diseases. They can also start to look at, you know, potential stuff for oral cancer. So, okay, one more time. I'm gonna pull your lip down like this a little bit. I'm just gonna take it nice and slow. Okay, perfect, good job. I'm gonna go ahead and deposit this over here. Okay, so I'm just gonna take the mirror and I'm gonna look one more time, just to look around. Your teeth look pretty good, actually. Okay. Just triple checking. Okay. All right, yeah, your teeth are definitely looking really good. So with that, that'll conclude our exam for now. But we're definitely gonna have you come back here soon. I would say within the week, honestly, just to have a full dental cleaning done on you, and just to make sure that your teeth are continuing to look nice and healthy. One thing I wanted to point out is that, you know, you might need braces again. Although your teeth aren't crowding or anything down here, there's kind of this odd way in which your teeth are kind of crowding around a little bit. So I think it might be best to look into Invisalign or braces, but we can discuss that at the next appointment, okay? Okay, so for now, I'm gonna bid you farewell and just come back and see us again soon, okay? For another dental appointment.